Welcome to the Thames Valley Cancer Alliance Health and Wellbeing series. At the Cancer Alliance, we work with colleagues across the Thames Valley, including Buckinghamshire, Berkshire, Oxfordshire and parts of Wiltshire, to bring you professional advice from health and wellbeing experts who work with people living with a cancer diagnosis. Our sessions range from specific topics such as managing fatigue, dealing with anxiety and coping with symptoms that you might experience during and after treatment, as well as more general lifestyle advice such as getting active. These sessions are for you. We want to bring you information that helps you live with a cancer diagnosis, whether you're recently diagnosed, actively having treatment, or at any other stage of your journey. These sessions might also help friends and family who are supporting someone living with and beyond cancer. Today I'm here with Nikki Hayward, personalised cancer care nurse working in Buckinghamshire Healthcare Trust, and she's going to talk about the holistic needs assessment and the benefits of discussing aspects of your cancer diagnosis that maybe don't seem directly related to any treatment that you may be having. If you find this video helpful, please like it and subscribe to our channel. You'll be kept up to date as we publish more videos on the variety of subjects delivered by our speakers across the Thames Valley. Thanks for being here today, Nikki. Tell us who you are and what you're going to talk about today.
My name is Nikki Hayward. I am the personalised cancer care transformation nurse working in Buckinghamshire and helping to implement holistic needs assessments. I'm making a film today to explain what a holistic needs assessment could mean for you.
Shall we start by describing what we mean by holistic?
Holistic needs are looking at the needs of the whole person, things that are important to us in our everyday lives. We would consider our physical needs, our mental, social needs, everything that affects us day to day. So a holistic needs assessment for a cancer patient would look at everything that impacts on their lives from their perspective as a person living with cancer.
Can you talk about who the holistic needs assessment is for and give our viewers a bit more detail around what happens with the assessment?
So holistic needs assessments are available to all patients with cancer. We offer our patients a holistic needs assessment at diagnosis and end of treatment. Patients find it important to have an opportunity to discuss concerns when they're first diagnosed, because this is often the most shocking part of the cancer journey. You will be given a leaflet in a pack when you go to clinic to receive your diagnosis, and the leaflet explains what a holistic needs assessment is about. You will then be offered the chance to complete a holistic needs assessment. The offer will come through your CNS. You may receive it as an email, but you may also receive it in the post as a paper copy that you can then tick on boxes relating to the concerns that you can see on the lists that you'd like to discuss. When you complete your holistic needs assessment, the nurse will get in touch with you and arrange an appointment to have the discussion about the concerns that you've raised. At that appointment, which is usually around 45 minutes, but it can take a bit longer if you've got more concerns that you want to discuss, we'll make some notes together and we'll try and find some solutions to the issues that you've raised. Some of those issues we can signpost you to help maybe within your local community. We have an outreach team that can help to address some of the concerns. And we also have access to some really good information, booklets, and we can also send you some stuff online.
Can you give us some examples of the kinds of subjects that patients might raise when completing the questionnaire?
Within the assessment, there are questions relating to physical symptoms you might have, but also some psychological symptoms, some very practical issues. Things like sleep problems may come up, things like financial issues, also thinking about the future and uncertainty about your diagnosis, how you might talk to children, how your partner may be affected and how you might be able to find help in talking to your partner, maybe your children and maybe relatives or friends about your diagnosis. In a way, the holistic needs assessment gives you the opportunity to talk about things that you may not have thought your nurse would be able to spend time talking to you about. And the other good thing about holistic needs assessment is that you can instantly see these are things that other people in your situation may be suffering with as well, maybe have questions about. We hope that it helps you to not feel quite so alone when you've been diagnosed.
Where does the consultation take place? Is this typically in hospital or can it be done over the phone?
Some patients prefer to come in and have a face-to-face consultation. Some patients prefer to have a telephone consultation, and it really is up to the patient, and we will make ourselves available. It's very personal choice.
Tell us what happens after the assessment has been completed. What are the next steps?
Once we've finished the consultation, we will print out your care plan for you, and we will send a copy, if you want us to your primary care team, which is the team that works out of the GP surgery where you live. They can help you to live with your diagnosis, even if you think it's gone. I know that it's very valuable to have that team on board, so that would be something that we'd encourage you to do.
So the information can be shared with the patient's GP surgery, their primary care team?
That's actually quite important, because your primary care team will be conducting a primary cancer care review with you. And it's really good for the team to see what's bothering you other than your physical symptoms. You know, sometimes these issues that you've been experiencing, they last a little bit longer, and sometimes they last a lot longer.
You mentioned that the assessment is offered around the time of diagnosis and at the end of treatment. Could these be offered elsewhere in the patient's journey?
Those offers go out at different times when someone highlights the fact through some sort of interaction that they may be having some issues that they could benefit from talking about. And at that point, the CNS may pick up that that's something that would help them and will offer them the opportunity. So whilst diagnosis and end of treatment are the main points at which an offer will go out, they can be offered at any point that the patient highlights they're having concerns that aren't being addressed. It's really about us picking up those cues and helping patients through those difficult times when, we can help them.
Would you give us a quick recap on the purpose of the holistic needs assessment?
So the purpose of the holistic needs assessment is to help the patient to take control of their journey, to highlight what matters to them, so they feel more in control and can move forward.
And any final thoughts on what viewers can take away today?
I would recommend all patients have a holistic needs assessment. It gives you the opportunity to really think about how you've been affected by your diagnosis and what's really important to you, so that we can treat you the best way that we can, and we give you time to really address those issues so that you can live as full a life as possible. We're here for you, and this is what a holistic needs assessment will do for you. There are so many people living with a cancer diagnosis at the moment, so you are not alone.
Thank you very much, Nikki. We really appreciate your time. And thank you for your time today. If you found this video useful, please like it and subscribe for the latest health and wellbeing sessions. Please leave us your feedback in the comments. We'd love to hear your thoughts on subjects you'd like us to bring you and any questions we can answer in future sessions. To find out more about the Thames Valley Cancer Alliance, please visit our website. Details are in the description for this video. You can join our mailing list. We'll let you know about new videos and details of live events that will be coming online in the future. You can also find details on how to get involved with the work that we do at the Alliance. Thank you again, and we look forward to bringing you more of the information you want to see.